Keshitere. Ladies and gentlemen, it is a great pleasure to join you here today in Butere Sub-County to commemorate the 34th World AIDS Day. We observe this day alongside other counties in Kenya and other countries across the world as we continue to fight towards ending new HIV infections by 2030. On this World AIDS Day, we fondly remember more than 2 million Kenyans that have lost their lives to HIV and AIDS since the first reported case in Kenya in 1984. Therefore, we celebrate life. We celebrate the strides we have made in fighting the disease to close to 4 decades, and thus, we celebrate our people living with HIV and AIDS. We celebrate you for being our ambassadors for prevention and demonstrating that positive living is possible in spite of the HIV infection. It is encouraging to note that HIV prevalence among people aged 15 to 49 years in the general population has declined from 9.1 in 2000 to 4.3 in 2021. New HIV infections have reduced from about 101,400 in 2013 to 34,500 in 2021, while the annual AIDS-related deaths declined by more than half from around 52,900 in 2010 to 22,300 in 2021. The Global World AIDS Day theme for this year, 2022, is Equalize. This is a call to end inequalities that impact access to HIV treatment and prevention services. In Kenya, in line with the global theme, our theme is Sawazisha, meaning to end the triple threat, end new HIV infections, end teenage pregnancies, end sexual and gender-based violence among adolescents. It is my humble appeal to all the stakeholders to ensure a collective action approach to end the triple threat that perpetuates inequalities among adolescents and the young people. The government of Kenya has brought this pertinent social issue into sharp focus over the past few months through the Triple Threat campaign. Ladies and gentlemen, in Kakamega County, we have adopted a multi-sectoral approach with all relevant stakeholders to campaign against and intervene towards ending the triple threat of HIV infections, teenage pregnancies, and sexual and gender-based violence amongst adolescents and youth. This is an issue which is close to our hearts as fathers, mothers, guardians, brothers, and sisters. Through this campaign, we continue to encourage and create platforms for honest and open discussions on these increasingly worrying issues in our society. Out of more than 2 million people who live in Kakamega County, more than 40 of the population are adolescents and young people aged between 10 to 24 years. Our young people are either already part of or soon to be part of the productive population in the county. Their welfare is therefore everyone's business. According to the most recent Kenya Demographic Health Survey, the median age for sexual introduction in Kenya was estimated to be around 18 years for women and 17.4 years for men. This means that most of our children are having their first sexual encounter while still in high school. Such times call for more active participation of parents in their children's lives. To this end, I urge fathers, mothers, and guardians to do their best to nurture our children as well as develop a relationship that shall foster open sharing where they may face any challenge. I also encourage parents to openly talk to your children about sex, reproductive health, and action towards safeguarding themselves from sexual predators. Ladies and gentlemen, right here in Kakamega County, the HIV prevalence is 3.9%, meaning that an estimated 4 out of 100 people live with HIV. More than 90% of the residents living with HIV are currently being managed at our health facilities across the county. In the last 6 months, 3.7% of the newly diagnosed HIV clients in Kakamega County were adolescents aged between 10 to 19 years. This means that every 27 people who were newly diagnosed with HIV, one of them was a teenager. Regrettably, Navakholo sub-county and Butere sub-counties have recorded the highest infection rates in this age category at 7.1 and 5.1 respectively. In the same period, 23% of all pregnancies in Kakamega County occurred among adolescents from Butere and Ekolomani sub-counties, reporting almost 28% teenage pregnancies, accounting for approximately 1 in 4 pregnancies across the county. Ladies and gentlemen, it is sad to note that today, reporting about cases of sexual and gender-based violence across Kakamega County is suboptimal. For various reasons, survivors and their families do not report SGBV cases occurring within our communities. A lot of effort needs to be put in order to improve sensitization of communities in both prevention and reporting for corrective measures to be taken. This year, Butere sub-county has recorded only 6 out of 527 survivors documented across the county. We continue to hear of the devastating effects of HIV infection, early pregnancy, and sexual and gender-based violence in our county. Today, as we celebrate the World AIDS Day, barely a week after launching the 16 days of activism against gender-based violence at Bomani Grabs in Mumias West Sub-County, where we got the heartbreaking yet triumphant experiences of 2 young mothers. While we acknowledge that although the triple threat disproportionately affects the girl child, the boy child is also at risk. We continue to advocate for male involvement through initiatives such as priority treatment for mothers who attend clinic with their male partners, community-level sensitization of men on various health issues, and dignity packs for adolescent boys. Without the support and collaboration of our men and boys in the community, we shall not sufficiently prevent nor manage the triple threat. We shall not be able to ensure that our young people live healthy lives, successfully complete their education, and go on to positively contribute to society. I therefore challenge and encourage our sons, brothers, and fathers to take an active role in ending the triple threat of new HIV infections, teenage pregnancy, and sexual and gender-based violence. Furthermore, I would like to remind you that drug and substance abuse are significant contributors to these 3 issues. We are therefore working closely with the relevant stakeholders to curb drug and substance abuse among our adolescent and young populations. At this juncture, ladies and gentlemen, I wish to remind us that Kakamega County has policies on HIV and SGBV. Just last week, His Excellency the Governor FCPA Fernandez Barasa launched the Kakamega County Community Health Services Policy. All these health policies empowers mwananchi, the administration, and our first-line doctors, community health volunteers, to courageously and actively participate in the war against HIV, SGBV, and other ailments in the society. I wish to applaud the Governor following his recent directive to ensure that all our CHVs receive their 2-month stipend owed to them by the government, and that the monthly stipend shall be enhanced from 2,000 shillings to 2,500, starting the next supplementary budget. On this day, I would like to express my gratitude to all stakeholders who continue working hand in hand with the county government of Kakamega towards ending the triple threat. I thank our community members, both men and women, who play an important role in imparting morals to our upcoming generations and also ensuring that perpetrators face the law. In a special way, I wish to appreciate the community health volunteers, our daktari mashinani, both the national and county governments county governments, administration officers who are our community first responders. The government of His Excellency Finance Barasa recognizes the important role that our stakeholders play in ensuring a healthy society. I would also like to thank the different stakeholders that are involved in the coordination of specific prevention and response strategies. They include the national government departments and agencies, the county government, and all non-governmental stakeholders. As the new Kakamega County Nutrition Champion and the county patron to the nutrition champions, once more, I congratulate our HIV-positive mothers whose babies have been tested negative by promoting optimum nutrition for the first 18 months and hence the HIV-free babies. I thank you for adhering to the doctor's prescriptions of ARVs and optimum early childhood nutrition as we work towards the start-free, stay-free, AIDS-free framework. All these efforts, among others, ladies and gentlemen, proves that our interventions are achieving the desired goal of reducing new infections across Kakamega County and conforms to this day's theme, Sawazisha, and the triple threat, and new HIV infections, and adolescent pregnancies, and sexual and gender-based violence. I take this opportunity to remind the people of Kakamega County that when the professionally prescribed medications and measures are adhered to well, a HIV-positive mother can deliver and raise a HIV-negative child. I encourage our HIV-infected people in the community, in the county, to continue living positively by adhering to the freely available and retroviral drugs that are found in all our health facilities. I further urge those who are HIV-negative to take available preventive and protective measures such as abstinence, fidelity to one sexual partner, the use of condoms, and prevention drugs when exposed to the risk of infection such as post-exposure prophylaxis and pre-exposure prophylaxis. On this day, we strongly speak against stigma and discrimination of any form against people living with HIV and emphasize that their rights as Kenyan citizens must be upheld as prescribed by the Kenya Constitution 2010. Lest we forget that these are our sons, daughters, brothers, sisters, mothers, and fathers. As we commemorate here this World's AIDS Day, having appreciated our various stakeholders for their contribution and collaboration towards ending the new HIV infections and maintaining the dignity of people living with HIV, I wish to call upon the stakeholders, the national government, Kakamega County leadership, our development partners, civil society organizations, the private sector, activists, men and women, the youth and children to continue supporting the following interventions. 1. Promote the rights of those living and affected by HIV. 2. Address HIV-related stigma and discrimination that hinder access to prevention and treatment services. And 3. Promote and accelerate action towards ending new HIV infections among children, adolescents, and young people. As I conclude, may I take this opportunity to remind us that HIV and other STIs continue to be transmitted amongst us. Let us not be complacent so as to lose the gains we have made over the past 4 decades. I once more urge all stakeholders to come together and continue the fight against the triple threat, HIV and AIDS, teenage pregnancy, and sexual and gender-based violence. Thank you all, and may God bless you. Mniruhusu niongee kidogo tu kwamba vile ambavyo tumesherehekea siku ya leo kuadhimisha siku ya HIV and AIDS duniani, ningeopenda kuwahimiza watu wote tushirikiane pamoja kuhakikisha kwamba maambukizi mapya yanapungua. Either maambukizi mapya yapungue ama yasipatikane kabisa. So hii inahitaji ushirikiano wetu sisi wote. Na wale ambao wameambukizwa tunawaomba wafuate maagizo ya daktari. tuliona hapa kwamba ukimeza dawa vizuri, ukule vizuri, fanya mazoezi, unaweza kuishi maisha ya kawaida. So wale ambao wameambukizwa tufuate maagizo ya daktari. Wale ambao hatujaambukizwa tujichunge. Tukumbuke kwamba mtu kupata HIV ni bahati mbaya. Hakuna mtu ambaye angependa kupata ugonjwa, but ni bahati mbaya, na kama umeupata ufuate maagizo ya daktari. Kama hujaupata ujilinde, ujikinge, lakini usimdhulumu yule ambaye amepata ugonjwa wa HIV. Kumbuka ni ndugu zetu, ni dada zetu, ni mama zetu. So tuishi nao kwa njia nzuri bila kuwadhulumu na bila kuwabagua. Vile vile tuweze kuwachunga watoto wetu. Tuliona hapa ule msichana alikuwa anaigiza kwamba amepata mimba ya mapema. So watoto wetu tuweze kuwaangalia vizuri, hasa wakati huu wa likizo. Wamefunga miezi miwili. So wazazi tuweze kujua kwamba watoto wetu wako wapi na wanafanya nini. Ndipo sasa inapofika Januari, mtoto asirudi shule akilabda amepata ugonjwa, ama asirudi shule akiwa amepata mimba ya mapema. Tuweze kuwaangalia vizuri ili waishi nasi kwa holiday vizuri, na Januari inapofika rudi shuleni wakiwa hawana shida yoyote. And specifically ningependa kuwakumbusha kwamba tuangalie watoto wetu wasipate mimba za mapema. Kwa sababu wanapopata mimba za mapema maisha yao yanaharibika. Na hizi mimba za mapema zinaandamana na wakati mwingine atapata ugonjwa ama apate STI nyingine ambayo si lazima iwe ni HIV. Jambo lingine, tuangalie watoto wetu ili wasiweze kupata mateso, wasidhalilishwe. Kama tunavyojua kwamba kuna watoto wetu wanakuwa raped mapema. And there is a case in Nabaholo ambapo mtoto wa miaka 7 amebagwa na baba yake. So ningependa tuwe waangalivu na tuangalie watoto wetu ili wasiingie katika shida. But ningependa kusema kwamba kumbaka mtoto wa miaka 7 ni jambo mbaya sana. And then I wonder, mwanaume mzima ambaye ako na akili timamu, mtoto wa miaka 7. Kuna wanawake wengi duniani. Kuna wanawake wengi Kakamega County. Kuna wale wanatamani hata mwanaume amuite tu jina lake. Hawajai ulizwa jina. So why should we go for mtoto ambaye ako na miaka 7? So ningependa tuishi na watoto wetu kwa njia mzuri ili waweze kuishi maisha yao kama watoto. Let them enjoy their rights as children. Halafu mwishowe waweze kwenda shule. Mwisho, Butere sub-county iko na hali ya juu ya maambukizi ya ukimwi. Vile vile Butere sub-county iko na hali ya juu ya watoto ambao wanapata mimba za mapema. So as a sub-county ningependa tufanye mpango. Tuhakikishe kwamba tunapunguza hii hali ya maambukizi ya ukimwi katika sub-county yetu, na vile vile tupunguze hali ya mimba za mapema kwa watoto wetu wasichana. Kwa hivyo watoto wetu wasichana na wavulana tuishi pamoja kama ndugu na dada bila kusababisha mwenzetu apate mimba ya mapema na aache shule. But wazazi ningewaomba tusaidiane ili tuwachunge watoto wetu. Kwa hayo machache, asanteni sana. Mwenyezi Mungu awabariki.